Alright guys, so today we are going to talk about the toxicology of alcohol. As usual, make sure you are filling in your notes, taking notes on the side in the margin of your PowerPoint for any key points that I say that might not be written down. And don't forget to answer the embedded quiz questions as you go along. So, toxicology of alcohol. Well, first off, the primary type of alcohol found in most beverages would be ethanol. So that's actually, when we were doing our urine analysis lab, you guys were testing for ethanol, if you remember. And that's because it's the type of alcohol that's typically found in these type of beverages. Ethanol is absorbed through an individual's stomach and their intestines. And once it's absorbed, it's metabolized or broken down in the liver, which, if you think about it, makes sense because a lot of alcoholics go into liver failure, which could eventually lead to their death. Well, when it's metabolized in the liver, it's broken down into acetaldehyde. And then the acetaldehyde is further broken down into acetic acid, which is just vinegar. So make sure you're writing acetic acid equals vinegar. Well, guess what? If there's too much acetaldehyde in an individual's system or in their blood, it's going to make them very dehydrated, and it's going to give them those classic hangover symptoms. A migraine, a headache, nausea, vomiting, or just overall weakness in general. And acetaldehyde is going to be excreted by an individual breathing, just through respiration in general, perspiration, which would be sweating, and the kidneys. There are a lot of symptoms for alcohol intoxication. The first thing that you need to know is that alcohol affects the central nervous system. That's what CNS stands for. The central nervous system's ability to analyze that sensory information, which is any information coming to you in which you need to use your senses. So seeing, touching, feeling, breathing, anything like that, those senses are going to be affected. Oops. Okay. So one of the things is going to be decreased motor coordination and balance, okay, which is going to be an individual's ability to walk in a straight line. That's why officers, if they think somebody might be driving under the influence or intoxicated, then they're going to test their motor coordination. That's why they have an individual stand up straight, hold their arms out, touch their nose, walk in a straight line, because if they are intoxicated, they are not going to be as coordinated. And also remember, alcohol is a depressant, which means that there's going to be a decrease in your heart rate, okay? So that's another factor you're going to want to keep in mind. Slurred speech and blurred vision. Well, if your motor coordination isn't working properly, right, your tongue isn't going to be working properly, so you're going to end up having slurred speech. Blurred vision, sweating. Okay, also, as you've probably seen in movies, if somebody is intoxicated, they're not making the right decisions. Okay, so you have that loss in judgment. Oftentimes, if an individual is in a car accident and they are under the influence of alcohol, they have a tendency to not be as injured as somebody who might not be under the influence of alcohol. And that doesn't mean that is a good thing, okay? In fact, a lot of times if there is a car accident in which somebody was drunk driving, the person that was drunk driving normally isn't in as bad condition as the person who was not drunk and who was hit. And that's actually because they, first off, have a decreased sensation of pain. And the second thing is their decreased heart rate makes them more relaxed. So when the actual collision occurs, they're not tense, which has a tendency to make them not have as many injuries because they're relaxed when they hit, which is devastating for the individual who was hit by the drunk driver. Another symptom of alcohol intoxication is going to be the loss of the ability to judge distance and height. So if you think about it, this individual now has decreased motor coordination, decreased balancing abilities, blurred vision, and now they don't have very good depth perception or the ability to see distance or heights. So that's why somebody who is drunk is often falling all over the place. Okay, and the last symptom is going to be dizziness. So this combined with the decreased motor coordination, balance, blurred vision, and depth perception, this combined with dizziness is going to make them falling all over the place. Okay, so how alcohol affects your body and other factors that could affect intoxication. Okay, well, first off, you've probably seen in movies how they might mention that they need to eat before having a few drinks. Well, that's because if there's food in an individual's body, it actually makes it different in terms of actually absorbing the alcohol through the stomach and the intestines, right? Because it's going through the same path. So if an individual has more food in their system, then they will have a higher alcohol tolerance, opposed to if they didn't have anything to eat that day, then their body is going to be absorbing the alcohol very quickly, and they are going to get very drunk very fast. The strength of the drink and the rate at which the individual is drinking is going to be another factor. For example, liquor often has a higher concentration of alcohol per unit of volume compared to a beer. So if there's an individual that's drinking liquor very quickly and is with another individual who is drinking beer very slowly, then the individual drinking beer quickly is going to be getting drunk or intoxicated much more quickly than the individual that is slowly drinking beer. The next two are body weight, body type, and gender. So if you have a male that is drinking with a female, well, the male is going to be much bigger. They're going to have a higher body weight, generally speaking, not always. And they might even be stockier than the woman. So let's say we have a male that's 6'2" and a woman who is 5'2" that's very petite. Well, if they're drinking together, the woman is going to most likely get intoxicated more quickly than the male and more easily than the male. And this comes down to functional tolerance as well. So functional tolerance just means basically how often does this individual drink? Do they drink every day? Are they an alcoholic? Well, if that is the case, then they're going to have a higher tolerance to the alcohol, which means they can consume more alcohol without getting intoxicated as easily, opposed to another individual who maybe only has a glass of wine once every few weeks, or once a month even, or even somebody who just doesn't normally drink. So if you are comparing their intoxication levels, somebody who doesn't typically drink is going to get intoxicated much more easily than somebody who drinks often. And then the last two things are medications and illness. Those two go hand in hand. If you look at perhaps one of your grandparents' pill bottles, it might say, do not consume with alcohol. Okay, or warning, this medication cannot be taken if alcohol consumption is involved. Well, that has to do with how the alcohol is actually interacting with whichever medication it is. Okay, and lastly, illness. Well, if an individual is ill, then chances are they might be taking some type of medication, and the alcohol can counteract that medication. For example, if an individual is taking an antibiotic for strep throat or something along those lines, well, if they drink alcohol, that's actually going to cause the medication to not work properly. Okay, and as we have stated before, these medications can just affect the level of intoxication an individual is at. Okay, so there are 4 ways that alcohol content is measured. Okay, and 3 of them are essentially an indirect analysis opposed to the last one, which is just a direct analysis of the blood alcohol concentration. Now, blood alcohol concentration just basically means what is the concentration or the amount of alcohol in an individual's blood. Well, the first thing we're going to talk about is a field sobriety test. That is the test that if you are ever driving and you see on the side of the road there's an individual that might be standing on one foot with a police officer and touching their nose. while the police officer believes that they might be intoxicated and will be testing their coordination skills, okay? This would be the first test to decide if they actually need to do an analysis of their blood alcohol concentration levels. So this basically will only determine if their coordination is possibly impaired, and we'll have to do further tests to actually confirm what they believe. So the next test is going to be a breath analysis test. And this is most commonly going to be done using something called a breathalyzer, which an individual will just blow into, and it will indirectly measure the blood alcohol concentration by basically getting an idea of how much alcohol is on the individual's breath. Okay, and this is done using a formula that the breathalyzer will actually do for the police officer. Okay, and like I said, it's indirect and it's an approximate blood alcohol level. The next one is a urine analysis. Well, you guys did the first step of this in your lab the other day, which you actually tested to see if there was ethanol in the individual's urine. Okay, well, toxicologists can take this to the next level and actually analyze the blood alcohol concentration, once again, indirectly related to the amount of alcohol in their blood. Okay, and for the most part, something you need to know is it can take up to 2 hours for alcohol to show up in urine. So if this test is done and the individual just drank the alcohol, it might not necessarily show up right away. However, it still is an indirect measurement of blood alcohol concentration. Okay, and that's going to be through the amount of alcohol found in their urine. Okay. And then lastly, and the most direct analysis is the blood analysis. So this would be when a sample of blood is drawn. They could do this at police stations, okay, from a subject, and it's taken directly to determine their actual concentration of alcohol in their blood throughout their body, okay? And another important factor is the amount of alcohol an individual consumes is going to be at its highest level about an hour after they drank it. Okay, it's very, very quickly absorbed from your stomach, your intestines, and into your bloodstream. All right, so this covers, you know, the 4 primary types of tests, and the important thing you need to remember is field sobriety is just going to indicate if further tests need to be done. Breath and urine analysis are indirectly related to blood alcohol concentration, but are still very, very important and valid tests. And then the most direct relationship is going to be that blood analysis test. All right, guys, make sure you answer all of the quiz questions and fill in any important notes. And make sure you submit it on Edpuzzle. All right, I'll see you tomorrow.